Sexually transmitted diseases, or STDs, are diseases, infections, or illnesses that are generally passed from one person to another through sexual contact. Although STDs doesn't always have or cause symptoms, there are a few that might indicate an STD, which include sores or bumps on the genitals or in the oral or rectal area, painful or burning urination, discharge from the penis, unusual or odd-smelling vaginal discharge, unusual vaginal bleeding, pain during sex, sore, swollen lymph nodes, particularly in the groin but sometimes more widespread, lower abdominal pain, fever, and rush over the trunk, hands, or feet. If you have any of these symptoms and or had unprotected sex, it's important to get tested.
The 7 most common types of STD are HPV, or human papillomavirus. It's usually harmless and goes away by itself, but some types can lead to cancer or genital warts. Chlamydia can be easily treated with antibiotics. However, if it isn't treated early, it can spread to other parts of your body and lead to long-term health problems. Gonorrhea, this can cause infertility and other health conditions if not treated. Syphilis spreads from person to person via skin or mucous membrane contact with this source. Herpes, these viruses are contagious and they are transmitted from one person to another through skin-to-skin contact. Trichomoniasis can lead to severe health problems. HIV/AIDS, acquired immunodeficiency syndrome, is a chronic, potentially life-threatening condition caused by the human immunodeficiency virus. By damaging your immune system, HIV interferes with your body's ability to fight infection and disease.
Sexually transmitted diseases or sexually transmitted infections are generally acquired by sexual contact. The organisms that causes sexually transmitted disease may pass from person to person, in blood, semen, or vaginal and other bodily fluids. Sometimes these infections can be transmitted non-sexually, such as from mother to infant during pregnancy or childbirth, or through blood transfusions or shared needles.
General awareness about STDs is necessary to control further waves. The introduction of sex education is one of the steps taken by the government, which aims at creating awareness among adolescents about safe sexual practices. Apart from the awareness and education part, it is also essential to provide proper medical facilities to deal with problems related to STDs. Here are some prevention that you can do. Avoid unprotected sex. Avoid sexual contacts with multiple partners. Consult a qualified doctors for diagnosis and treatments.
Sexually transmitted diseases caused by bacteria are generally easier to treat. Viral infections can be managed but not always cured. If you are pregnant and have an STI, getting treatment right away can prevent or reduce the risk of your baby becoming infected. If you are given antibiotics to treat an STD, it is important that you take all of the drug prescribed to you, even if the symptoms go away. Also, do not take someone else's medication to treat your infection. It may make it more difficult to treat.
A wonderful day to all of you. In this video, you're gonna learn about the type of STD, which is HIV and AIDS. So what is HIV? Human Immunodeficiency Virus, or HIV, is a virus that attacks cells that help the body fight infection, making a person more vulnerable. What about AIDS? What is it? So AIDS is the late stage of HIV infection that occurs when the body's immune system is badly damaged because of the virus.
But how do HIV and AIDS differ? HIV and AIDS are related, but they are not the same. HIV is a virus that attacks the immune system, and AIDS is a term that can only be used when HIV has caused severe damage to the immune system. Not everyone who has HIV will get AIDS. A person can have HIV without developing AIDS, but it is not possible to have AIDS without first having HIV. A person with HIV who does not receive treatment can develop AIDS.